Good afternoon. Welcome to the first webinar of our partnership series for the County Health Rankings and Roadmaps program, Working Together, Starting the Conversation. Today, we'll be starting the conversation about the conditions that promote people working together effectively for change. My name is Jan O'Neill, and I'm a Community Engagement Specialist and Coach with the County Health Roadmaps Project. My colleague, Karen Odegaard, is also here to help answer your questions along the way. We're pleased to be joined by Jerry Shultz and Christina Holt of the Work Group for Community Health and Development at the University of Kansas. Jerry serves as co-director of the KU Work Group, directing collective impact research and capacity building efforts. He brings years of coalition building experience to today's conversation. Christina supports the development of online support for this work through the Community Toolbox, more than 7,000 pages of free resources supporting community change and improvement. The County Health Rankings and Roadmaps program is the result of the contribution of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. We want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see my screen throughout the presentation. On the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we'll be taking questions via the control panel. So please feel free to enter your questions in the control panel at any time, and we will answer them toward the end of the webinar, sometimes even during the webinar. If we don't get to your question during the webinar, though, we'll follow up with an email. So here's a quick outline on today's webinar. We're going to start with an overview of County Health Rankings and Roadmaps just to get you reacquainted with our program and the site. We'll then talk with Jerry and Christina about what they've learned about the conditions for working together effectively. We'll learn about incentives that promote working together, the role of staff and volunteers, tips for partnering across organizational boundaries, and the value of a common measurement system. We'll then open it up to Q&A. After Q&A, we'll show you where you can find guidance and tools on our website, and we'll highlight one tool, the historygram process, in particular. Finally, we'll wrap up with some closing comments. And again, if at any time you have a question or a comment, please be sure to write to us in the question box. By the end of this webinar, we hope that you will understand the conditions that affect people working together, understand the incentives that promote people in groups working together, understand the role of staff and volunteers in helping people work together, and understand the value of a common measurement system for collective action. This webinar and the handouts and slides will all be archived on our site, and Karen has chatted that link out to all of you, and she'll be doing that again at the end of this webinar. Now what I'd like to do is a quick poll to find out who's in the room with us. So I showed you some of the questions, the options before, but we call this a rapid response poll. We'll give you about 30 seconds, and I'm going to launch it now. And if you could just let us know which describes best where you're at as a community. Great. Thank you very much for responding. We have quite a few attendees online with us today, about 137 it looks like at this point. Maybe more will join later too. And I'll give you another couple of moments here to finish up your answers. And I'm going to close it in 5, 4, 3, 2, and 1. So I'm going to close the poll now. And then let's take a look at this. So Jerry and Christina, are you on right now? Can we hear you?
Yeah.
Jerry and Christina?
Yeah, we are on.
Great. What do you see in the answers here, you all?
Well, it looks like it's an interesting distribution across the levels of collaboration. looks like some folks are able to really work together collaboratively, and we've got the range from almost isolated work to full collaboration.
Yeah, and that's what I'm seeing here too. It's the full range, and it's really interesting. The good news, it seems, is the smaller percent of people still sort of doing parallel play, if you will, and a large number of folks that are networking and sharing information. So this is great information for you all when you do your presentation. I think that it really tells us where people are at in terms of beginning to coordinate and communicate and so forth, and really getting all the way into collaboration and planning. Many of the pre-registration questions, which I shared with you all also before this webinar, reflect this in that many of the questions had to do with what's the value of shared measurement for sustaining the effort. And so this makes sense if a number of you are 90% at collaboratively planning, and then others about how to get started. So we really have the full range here. I'm going to hide the poll now. And let's just jump over to the essential question for today's webinar. Those of you who have been on prior webinars with us or know our website well will recognize the action cycle. And we try to design a thematic question for each of these partner webinars around which we weave the content. So for today's webinar, the question is, how can people work together to make a collective impact? And we'll come back to this question at the end of the webinar. Hopefully you'll have some answers to this and maybe even walk away with some new questions. So let's go to the rankings and roadmaps overview and do a quick tour of that. We always like to start with this logic model, which explains why we're creating the rankings in the first place. The goal is to help our country create a healthier nation, county by county. And we keep the number of measures very small. They're just 30 this year. These are measures that every county uses. So you'll see on the left, the population-based data is collected. I call that the Dave Barry approach. We're not making this stuff up. It comes from other sources, and you can go on our website and see what those sources are. And they're already existing. And then we have a formula for calculating the rankings for almost every county. The only counties left out are those that have too small a sample size. And we release the rankings every year. Last week was our fourth, or a couple weeks ago was our fourth year of releasing those nationally. That tends to attract local and national media attention, which really gives community leaders like you who are on this webinar a tool for leveraging the community, your community locally, to come together and start taking action, to mobilize. And we encourage communities to use evidence-informed policies and programs, and I'll talk about what works for health, our database, in just a moment here. And the bottom line is we want to make sure that in the long term, health outcomes are improving over time so that number of premature deaths is dropping and that the quality of life is improving in your community. And really, it's all about a call to action. It's a place to start the conversation. It's not a place to stop it. You want to be able to go in deeper and look at your own local data after those rankings are released. So it's really a tool for garnering attention and taking action. Now we have two rankings that we provide every year to every county. One is a health outcomes ranking, and that has there are two separate messages here. The health outcomes we call today's health, and that's those measures of premature death and quality of life. And then we also rank the health factors, which in a sense is the county's potential for improved health. So those we call tomorrow's health. And what they're all based on is this model. Starting from the bottom, we believe that effective local, state, and federal policies and programs can improve a wide variety of factors. And these factors, these health factors, in turn, shape the health outcomes of communities. And we specifically look at and weigh health behaviors, which is 30% of the model, clinical care, which is 20%, social and economic factors, which are fully 40%, and the physical environment, which is 10%. So here's an example. A clean indoor air policy is a policy that's evidence-informed, that can influence health factors such as tobacco use, which in turn influences health outcomes. So what this picture does is it graphically shows why it's so important for us to mobilize across multiple constituencies and sectors. Obviously, if I'm a healthcare provider, I can't do it alone. I'm only 20% of the bigger picture. Or if I'm an educator, I can't do it alone. I'm part of the 40%. So we need each other in order to turn toward less premature death and improve our health outcomes in our counties. And I think this is one of the most powerful pictures we can show to our communities to help explain why we need to work on policy and systems and environmental changes that will create long-term health outcomes. Many of you are familiar. You took the survey when you registered for this webinar and told us that you're familiar with County Health Rankings, and this is our home site. Some of you are not as familiar with the roadmap side of our site, so you may want to go and visit that at some point. And when you go into roadmaps, you'll see the Take Action cycle, and you'll see that we have an action center which provides guidance for every step of the Take Action cycle. You'll also see that you can go in and look at what works for health, which is a database, as I mentioned, of almost 200 evidence-informed policies and programs that you can choose from and select for your community and adopt and adapt. You can also, if you want to go deeper into the rankings themselves, click on using the rankings data. We are available, thanks to the Robert Wood Johnson Foundation, at no cost to communities to coach you in health improvement. So later at the end of this webinar, we'll give you our contact information as well. There's actually 3 community coaches on board, and we are here to help you. Also, I wanted to mention the great examples of what communities around the country are doing to improve their health. 6 communities were recently recognized by the Robert Wood Johnson Foundation, and their video stories can be found on our site. There's also lots of other stories that you can read and view, and they're great inspiration for communities of all types. So I encourage you to go in and look at the prize, and the applications are due May 23rd, and also go in and look at the stories that we have on our site. So without further ado, I think we'll go ahead and move to the KU Work Group for Community Health and Development. And our featured guests are we're very, very privileged to have them with us because we link to many community toolbox tools in our Action Center, and we really appreciate their contributions to County Health Rankings and Roadmaps. As developers of this wonderful resource, we're really delighted to have Jerry Shultz and Christina Holt join us for this webinar as a kickoff for our partnership series. So welcome, Jerry and Christina. And could you each tell us a little about yourselves before we talk about how to work together for collective impact?
Sure. This is Jerry. Hi, everybody. Just honored to be able to talk with you today. Just a bit of background. My background is in applied anthropology, which is really all about just, as with any applied work, is about understanding and helping. And the focus of that for me has been primarily around working with improving health equity, trying to reduce health disparities, and empowering communities to take action and make a difference with outcomes of interest to their community.
Good afternoon. This is Christina Holt, and I'm glad to be here today. It's been an honor to partner with County Health Rankings and Roadmaps. I direct the Community Toolbox, a free online resource on the how-tos for community change and improvement. I also oversee related online capabilities for online collaboration and documentation and evaluation of community efforts to make a collective impact.
Thank you both again so much for joining us. And Jerry, I'm going to turn to you first. The KU Work Group has been at this collective impact work for a long time, and you've developed a comprehensive model to describe what you've seen as the main elements that are needed for community change and improvement. Could you walk us through that model, please?
Sure, Jan, thanks. We have been working at this for a long time, and we've been working with partnerships and coalitions for over 20 years. And some of what you're seeing in this model are what we have learned. We've basically distilled learnings from our work with those coalitions and partnerships. I'll run through this model very quickly. The underlying model, the alphabetized ABC part of this model, the white boxes, is a model we developed over the years, and the Institute of Medicine has taken it up as the Public Health Action in Communities model. The major parts of this are, the beginning really with determining what the problem is and determining what the outcomes are that we're interested in working with. Doing assessment, developing plans and both strategic and action plans that focus the communal effort on those outcomes and those problems. So the letter A, 12 o'clock on the model. Once those things are in place, the community really has to start taking action. And this is not the action of the implementation of programs, but really the action it takes to get those things going, get those things in place. So when we're saying targeted action, it's working with the schools, working with the principals, working with the directors of health departments, working with the various groups in the community to enable and persuade them to take up new activities and new programs and implementing new policy. So that's the action to taken to implement new community changes. But what that does is, of course, lead to the third part of this model, which is new programs, policies, or practices that are being implemented across the community. And this is really where the collective impact takes place. This is where the rubber essentially meets the road, so to speak, because this is these are the things that are going to influence the behavior of the health behavior of folks we're interested in. And if we, essentially create enough change in the community, enough change in the environment that people are living in, we would hope to see health behaviors or reduced risk behaviors, increased protective behaviors, and ultimately those would lead to the health outcomes that we're interested in. So that's the underlying model. Now, overlaid on top of that are some of the factors and conditions that we've drawn from or have learned from as we've worked with coalitions and partnerships over the years. And there's about a dozen of these conditions or processes that really improve the likelihood that, if implemented, will increase the likelihood that the community is going to reach its intended goal, its reduced rates of diabetes or whatever it's working on. And you can see they're kind of clustered around the primary parts of the model. So around assessment and planning, you see the ability to analyze and understand information about the problem, developing the vision and mission that's going to guide the overall effort, developing an organizational structure where form really follows function in a way that allows the community and the partnership more broadly to function in a way that it can move together forward towards their outcome. And having a model or having a framework that guides that that organizational part and the partnership towards that goal. I won't spend time on all of these, but you can see that there are clusters of factors or conditions that make a difference. And I want to mention a few that perhaps do not get a lot of attention. The arranging of community mobilization often, it doesn't get enough attention, but it often requires mobilizers or volunteers or staff who can play that role, and that's such an important part of it. The availability of technical assistance and finding folks who can build our capacity as we're doing this work, documenting and looking at information that tells us how we're doing. And number 11, which is I think one that's seldom touched on, which is kind of how do we make outcomes matter so that people pay attention to them. And I want to just step back and touch again on I think leadership is another area that is so critical to helping move forward kind of a disparate group of voluntary associations that allow the community to make a difference and reach its goals.
That's great, Jerry. I really appreciate you taking us through your whole model, and Karen has provided a link to the PDF version of it, and it's also on your website. I just wanted to say just quickly about audio. You're kind of going in and out, so I don't know if you're moving forward and back to the phone, but that we're hearing that on our end.
Okay.
Let me ask you a question about leadership, because that's the one that you just touched on again. It's one of the promising practices you include, but it's not, leadership isn't perhaps something that people think about when they do this work, especially when they're feeling so urgent about fixing problems now. Can you give us an example of a community that invested their time and energy in leadership development and what the benefits were of that?
Yeah, so sure. If we think about leadership in terms of, it's bringing people together, it's communicating about what the mission and goals are, it's connecting, it's being the connector, it's all of those, a lot of those things which we'll talk about in a little bit more. But we work with a coalition in Wyandotte County here in Kansas that, because of the health rankings, has been, I think, the whole community has been spurred on to come together and work on the issues that are confronting them. But the coalition has really been structured in a way. It has working groups, action committees. It has a governing board that guides both distribution of resources as well as the overall policies of the coalition. But I just want to give two examples of leadership development, because there's both training and experiential development of leadership in that group. So some of the training is provided by us and others, but the structure of the partnership really allows for kind of homegrown leadership. One example is a woman whose name is Carmen, who lives is a resident in the community. Got involved with one of the projects, which was around gardening, but over the years has grown both in terms of engaging in the action committee work and then ultimately in the governing board, the community action board, which guides this. And so over the years, she's really developed her leadership capacity to connect, to show others, to expand how to do the work that she's engaged in, to expand that work to more among more residents in her neighborhood. And so that's just a kind of a homegrown leadership example. I think another example is the current mobilizer, who really, Monica, who comes from a kind of an educational para background, but has from the community, and this effort focuses on the Latino community, and has really taken on the responsibilities of connecting, working with the committees to connect them to partners who can help implement the projects that the committees are developing, handles the logistics of meeting, helping bring people together to meet and plan and think through the activities that they're working on, is a liaison with other partnerships and coalitions that are developing in the community related to the same kinds of issues, and so she's becoming a liaison between the various committees, both within the coalition and then across with other coalitions. And ultimately, I think it's becoming a real career path for her, in the sense that I think she's really becoming connected broadly to that community and is becoming a community leader in a real true sense. And so the leadership development takes place both as from training, but also is really kind of built into the structure of that particular coalition. And so, but that leadership really helps this group work collectively and really build kind of collective capacity of the overall organization.
That's great. I'm working with a group in Central Michigan, and their motto is, all we have to do is ask. People are waiting to be asked, so engaging them in the work of leadership is leadership capacity building. That's a great couple of examples. Thanks, Jerry. And it really gives the community capacity to do so much more together when people are actually involved in the work of health improvement. So you mentioned collective capacity. In 2011, John Kanye and Mark Kramer wrote a seminal article for the Stanford Social Innovations Review called Collective Impact. Christina, I'm wondering, could you tell us what is collective impact and what are the conditions that affect people working together, and why are these conditions so important?
Absolutely. So the 5 conditions of success for having a collective impact, as defined by Kanye and Kramer, are common agenda, Common agenda refers to participants having a shared vision for change, including a common understanding of the problem and a joint approach to solving it through agreed upon outcomes. The common agenda is really the reason people come together to bring about change. Second is mutually reinforcing activities. This is basically that participant roles and responsibilities must both be differentiated but also still being coordinated through a plan of action. Third is continuous communication. Open communication is needed across many players to build trust and appreciate common motivation. Fourth is backbone support, and this can be essential to collective impact efforts. Creating and managing large-scale collective impact efforts over time requires an organization with staff or volunteers and a specific set of skills to serve as a backbone for the entire initiative and to coordinate participating individuals, organizations, and agencies. And lastly, shared measurement systems provide a vehicle for collecting data and measuring results consistently. This is important for continuous quality improvement, building the evidence base for what works, and for assuring accountability.
Thank you for taking us through that, Christina. We've actually got a link on our website in the Action Center to several of their articles. They've written other articles since that really expand on this notion of collective impact. And it's a wonderful concept, but you know, it's really hard to do, isn't it? And especially when people work in different organizations with different missions and needs. So how can people bridge that challenge? Are there tips or strategies that you can give us for people to keep in mind as they work together across these boundaries of their organizations and communities? And Jerry, would you mind speaking to this?
Yeah, well, I think the tips for working across across organizations are, I mean, there's both small things you can do and there's large things you can do. But I just want to back up for 1 second because I think you're right. It is challenging, difficult work. But we always say, you know, you think of this whole work as a tapestry, and just, you know, we start kind of working on the edges of the tapestry and start working away at it, and eventually you end up with your tapestry. But you know, you start where you can. I just want to touch on a couple of. We've got a couple of points here that relate to, you know, what are the incentives for working together. And I just want to touch on a couple of these. You know, I think the whole point about clear information about the problem or goal is so critical, because it really kind of sets the ground for how people, well, first understanding the problem and understanding the level of the problem as a kind of an incentive to get people engaged, motivated, to begin to care about the issue. But this also means understanding the causes, the underlying causes, the root causes. You know, you always think about the fishbone diagrams and things of that sort, but that breaking out of the problem really allows all of the partners to find places for them to get engaged. And that's, I think, where that kind of information it has a couple of functions, or certainly it motivates us as well as allows us to find places to get to start working on that tapestry together. There are some other areas that we might talk about, and again, these are kind of, if you think about what motivates or moves people to work together. I want to talk a little bit about this idea of recognize and reward collaborative behavior, right? And we've come up with a catchy little 6 R's, but I just want to talk a little bit about each of them, because these are ways in which we can, what do people care about? If you come from the individual perspective, what motivates them? What do they care about? What would help lead them to behave in a collaborative way? And so we think these things are important. So people want to be recognized for the contribution. So as they're doing things, recognizing what they're doing is an important incentive. People also want to be respected for their values, for their ideas, their cultural background, the time that they're committing, those kinds of things. And people want to be respected for that, and that is something we all need to do as we're working with each other. And that respect really makes a difference. It leads to trust and things of that sort, which are really important. We want to be able to, people want to have a clear idea of what they can do. So having a clear sense of what role they can play within the overall effort is also very important. And they need to be meaningful roles for them. So understanding kind of what that is, what would be meaningful to them, is also quite important. But it makes them feel valuable. It makes them feel worthwhile, and I think they'll appreciate contributing if those kind of roles are made clearer. People love the opportunity, I think, to establish and build their networks. That's got to be, in terms of professional work, it's got to be so fulfilling to expand your connections, expand your relationships, both professionally and personally, because it's how we influence the world, and that influence is, I think, why a lot of us are in this business, right? We want to make a difference. We want to have an impact. The idea of rewarding. People want to be rewarded. They want to be rewarded for participating in collaborative partnerships, but that it has to kind of outweigh the costs to them. So we want to look for ways to reward folks that are above and beyond, that go beyond the kind of cost that they might incur in terms of time and effort. And then lastly, I think the last R that we're talking about here is people like to see results. And so we want to be clear that when things are happening, when there are results, that this is communicated, that what they're doing is linked to outcomes that matter to the overall effort. So I think the 6 R's are just a nice way of kind of capturing the ways we can build the motivation and engagement of folks across organizations and build those kind of collaborative relationships on a kind of individual basis. And then the last one, which really seldom gets touched on, and this is kind of, it's a little bit of an out there idea because it's just not done very often. So one idea is rewarding on a kind of the individual basis for interacting with others collaboratively. But then there's the idea of rewarding the overall effort for what does the overall effort get for working together? And so we've been pitching this idea of outcome dividends for as much as possible, because if we can show improvement in health behavior, for example, could we translate that into some sort of dividend that pays back to the prevention effort, so to speak? And so thinking about, and that's just an idea, but again, thinking about how do we make outcome matter so for the group as a whole. And again, that can also be recognition and some of those things we're using on an individual basis, but also think about that in terms of recognizing, rewarding, et cetera, the overall effort of all of the partners that are working on these issues.
That's great. I'm really glad you mentioned that last part, Jerry, about the outcome dividends. There's actually a story on our website from Hernando, Mississippi, where Mayor Chip Johnson worked very diligently with local business and insurance companies and health facilities and so forth to improve the fitness of their city. And as a result, they were able to pass savings on to the employees of the city. So I think that's an example of what you're talking about, right?
Perfect.
Okay, great. And people can find that story as an inspiration. It's right on our site in the stories section. Now, you've mentioned the Backbone organization, as does the Kanye article. This support requires quite a bit of shared responsibility, though, not just one organization. And Christina, I'm wondering, could you speak to the role of staff and volunteers in helping people work toward collective impact?
Staff and volunteers are both essential to successful community-based efforts. Staff do often help provide backbone support, and that might be located within one organization or shared across organizations. But this sort of support is really critical for things like helping to write grants, to obtain funding, setting and facilitating meetings, sending out minutes afterwards, etc., developing communications, documenting progress, and assuring community mobilization. Engaging diverse grassroots leaders and volunteers is equally critical. Grassroots leaders and volunteers help build public will, serve on working groups and committees to do essential work, and implement community changes, and provide invaluable guidance. Next. Engaging a diverse group of grassroots community leaders in meaningful ways does help assure community ownership, and staff providing technical assistance or arranging for needed capacity building supports can help ensure success of the efforts. Staff often help communicate within the initiative, but also with maintaining an up-to-date web presence, social media, and relationships with traditional media. Engaging volunteers in the media efforts such as blog writing and social media can also be powerful. And lastly, documenting progress via a common measurement system is ideally done by those most familiar with the efforts, likely including both staff and volunteers. Staff should prompt regular use of the data to guide strategic decision-making and real-time adjustments to ensure success over the long term.
Yeah, so can you talk us through what are the elements of a shared measurement system?
For a shared measurement system, we believe it is essential to establish agreed-on measures for outcomes and agreed-on data definitions for reporting community accomplishments. For example, we often help communities document community change, defined as new or modified programs, policies, or practices brought about by the effort and related to its mission. It is also essential to establish processes for documenting progress and using the feedback to improve the effort, such as whether there is sufficient progress in involving different sectors of the community in the change efforts. And lastly, the ability to make outcomes matter that Jerry talked about, and being able to do so through reporting, accountability, and other contingencies.
Would you like to, should I show the example of the value of shared measurement? You've got an example to share with us, I believe.
That would be great. And this example is from the Wyandotte County efforts that Jerry mentioned. And this shows efforts towards collective impact, so accomplishments in the red line, and a percentage of adults reporting consuming 5 or more servings of fruits and vegetables in the blue line. It's really important to not only keep track of those population-level outcomes of interest, such as fruit and vegetable consumption, but also to track the community accomplishments along the way. So the KU work group has developed an online documentation and support system for community initiatives that can help groups track those community and organizational changes, which can ultimately be associated with changes in population-level outcomes. So you see in this graph a correlation, an increase of fruits and vegetables consumption over time associated with different changes in the environment that are happening and changes of new programs, policies, practices, things like expanding access to fruit and vegetables, community gardens, tiendas that are selling fruits and vegetables, etc. Being able to show improvements in population-level outcomes and tracking community changes that have been associated with such changes is critical for understanding what works and for telling the community story, thereby increasing ability to sustain the efforts over time.
This is such a powerful picture. Thank you for sharing this. People are always asking, how do we show the impact? How do we show the impact of all of our strategies and policies? So thank you for sharing this. And so just to kind of wrap this part up, based on your lessons learned over time, what recommendations would you make to us, whether we're beginning just to work together or whether people have been working together for a while or they're well along in their work together? How can they make the most of their partnerships so they truly can make collective impact? And Jerry, I was wondering if you could speak to this.
Sure. Yeah, I think this is kind of reviewing some of the territory we've already talked about, but let's present these kind of as recommendations. So, yeah, I think one of the key things, and Christina was just talking about this, which is the development of a monitoring system to detect progress at the population level. This is, I think everyone agrees we need to, a collaborative effort needs to know what it's doing, and once needs to know whether it is making progress both at the outcome level but also at the implementation level. And I think that last graph was illustrated that very nicely, that the level of implementation of programs and policies and practices, really the dose of the intervention across the community, and then whether there's progress or improvement in the outcomes. But having a monitoring system in place that lets the entire effort see how it's doing is, I think, really really important. The development and use of action plans that really kind of name the importance of naming who's going to do what by when, and what are the steps that are going to be taken to accomplish some of the community changes, to implement some of the community changes. That process of strategic, but also really getting into the nitty-gritty of who's going to do what by when, and starting to name that is an important part of it. If you don't name it at that level, it's much harder for people to, less likely that people will engage in it. So naming that through action plans, I think, is another important part of this. Facilitating natural reinforcement. I think this is such an, for people working across sectors, I think this is just, we assume we do this. We assume that we are rewarding people, that there are incentives for doing that, but there's seldom incentives for doing that. But I think it's really important to think about this in terms of what naturally would reinforce that kind of behavior. And you have to know what that behavior is. So you really have to kind of identify what does it mean to work across sectors? What are the behaviors we want to see that tell us that we're doing that we're working collaboratively, and to find ways to reinforce that. For example, helping people connect and broaden their networks is sometimes very much reinforcing, just naturally, just as part of what we do as professionals or as practitioners. And that in and of itself will reinforce working across or with another organization. But helping to do that, I think, is the work of all of us. How do we help increase the connection? How do we help? How do we help introduce and bring those folks together so they can start working together? Some things of that sort that can help move the collaborative work forward. But you have to think about what is it we're looking for in terms of collaboration, and then what are the things that naturally support that. And there are other things as well. I think assuring, and these are, again, I want to remind us that these are recommendations, right? So this assuring an adequate base funding, we think it's really important that if you have seed resources that can seed new programs and help to implement new approaches, is important. But I think that this is a goal to work toward, and finding ways to do that in small ways is a place to start. There are, again, going back to the providing supports, the idea of, not everyone is equal in terms of capacity or skills, and making sure that the technical assistance or the training is available and can be provided to build our capacities along the way is also very important. And then lastly, and this connects back to the monitoring system, I think, but really connects to this whole approach, which is building a participatory approach, so that the partnerships are looking at what they're doing together, making decisions together about how to improve, how to redirect, how to reinvest, et cetera. But building a participatory evaluation system is also quite important. And again, I think if these recommendations are implemented broadly, it does increase the likelihood of success. No guarantees, obviously.
Oh, well, thank you so very much, Jerry and Christina, for sharing your thoughts. You've given us a great overview, and this is a terrific kickoff for our partnership series on how to work together, what the processes are, what the conditions are for successful collaboration, and some very specific things people can do to ensure success. And if you want to find out more about Community Toolbox, we'll put their link in the chat box for the webinar. We'll also be showing you in the Action Center momentarily where you can find specific tools linked to the action steps in our Action Center. So now what I'd like to do is open up to questions from our audience, and Karen has been gathering them as we go along. Do we have a question, Karen, that we could pose to Jerry and Christina?
Yeah, we have a couple of good questions here, and I think one of the questions that we're seeing here, I think, is really relevant to a lot of communities where they have a lot of organizations that are working on similar issues, and how do you address that fatigue? The community fatigue is what one person called it, that happens when you've got multiple organizations working on similar issues.
Well, I mean, I'll jump in. I think in some ways you have to keep making it exciting. And this is part of keeping I think the vision in front of folks, keeping the results orientation going, and it is kind of this idea of recognition, recognizing what people are doing, so that it's not, it doesn't have to be a burnout situation. If people are fulfilled by these efforts, it will continue to move forward.
And then also maybe important for the community to take a look at if everyone knows kind of what role they're playing and how they're working together towards their common agenda. It might be time for sort of a strategic reflection on, what the goals are and what strategies are being accomplished, and who is working on what pieces of the puzzle in order to work together most effectively.
I once heard it referred to as herding cats. So if we can somehow give people enough latitude that they can pursue their passion and work in the ways that they really enjoy and feel like they're bringing their best to the effort, but at the same time bring it all together into a feeling of we are all in this together. It's a coalition, a partnership. Yeah.
Yeah. If I could just add one thing, I'm not sure branding is the right term here, but the idea of creating an identity, creating a group sense of group identity around the issue that we are all kind of working on this together it's an important part of the process.
Yeah, that's a good point. Many of the communities we see and are working with have a website, and it's a place for everybody to meet up and to find out what's coming up and to check in on each other's work and so on and so forth. Karen, do we have another question?
Yeah, and again, this is another one that I think resonates with a lot of communities where they want to work on something, they're trying to get people to the table, but they keep hearing from potential partners that they don't have any money. How do you negotiate that? How do you work with people, help get people to the table when you maybe don't have money sitting there to offer, or folks don't have funding to do the work that you're asking them to be part of?
Yeah, well, that's a great question. I mean, it's nice if there are some resources, but if there aren't, then it is really kind of really understanding what drives them, what drives that group, and what's important to them, and really, and it's easy to say, but I mean, it really does take some. What's really fulfilling to them? What are they all about? What are they trying to accomplish? And it is this kind of common, finding the common interests, and then tweaking that a bit, because they're not going to be able to typically move, broadly speaking, but there are some, if you can just take small steps towards working together and finding that kind of common interest area that you can work together, that's the beginning of it, and then that grows over time, and with experience and trust.
This is Jan again, just to jump in. I've actually seen it where a community spent 2 years, this is a multi-county community, building that foundation and showing up over and over again in a volunteer capacity, and then the funding came because they were so together. They were so strategic. They had strong relationships. They knew what they wanted to do next. And I've been told by those folks that if the money had come first, they would have kept on doing what they'd always done and wouldn't have done anything differently. And so it was because it came afterwards, which I think is your point too, Jerry, is having that vision and that sense of who we are and where we are going here together. Do we have another question, Karen?
Yeah, we do have one other question here about, so you know, say you get these folks to the table and you get them discussing what needs to happen. How do you get them to actually take action? And building that will among your stakeholders and the folks at the table to take action. How do you get there?
Yeah, well, I mean, immediately I was thinking about servant leadership, servant leadership, and helping to, again, understanding them is important. Understanding the partners are important, and building those, helping to create conditions that help them take that initial step. Whether it's helping build their capacity. Finding the reward in the action step, recognizing small steps towards engagement. I mean, there's just it kind of does depend on them a little bit in terms of what really moves them, what are their interests and things of that sort.
And Jerry, I really like the idea of was it pick 6? You want to talk
about
that? I thought that was
That's great. Yeah, that's nice. Well, we always try to incorporate into the initiatives some seed resources, but what we've been doing is to identify small projects, small activities that any organization could engage in. And so it's kind of a smorgasbord listing of potential interventions or potential programs or activities that could be picked up. And so we promote it as a pick 3 or a pick 6. Here's 3 things that you could engage in. Sometimes if you have seed money, that's great, but if not, it's a kind of a smorgasbord approach to, here's some things you could do. How can we help you get those activities going at your church or your school or whatever organization you're from? It's a nice example.
We are getting lots of questions coming in through the chat function. Can we answer some more here, Jerry and Christina?
Sure.
Okay. So we have a question here. This goes back to the money question again, and I think it is a really good one. What if some partners have money but others don't? How do you keep people feeling like they're equal?
Great question. Well, again, I think recognizing accomplishments, making sure people are being rewarded and recognized for what they're able to do is one way of looking at this. This is not kind of an equal. Equality isn't always possible. Some organizations are just larger and have more resources, but I think that looking for ways to connect these organizations so that there are ways that they can find ways to collaborate, do things together. That does lead to a point where they might be able to seek and access further funding and other resources together. But I think finding ways for them to connect at their current levels is maybe a first step.
Okay, great.
Here's a quick one. Somebody has asked about whether they should have a written partnership agreement. And I know we have some examples on our website of written partnership agreements.
Huh?
Do you all have any words of wisdom on that?
Written partnership agreements can be really helpful. It does take time, relationship building and trust building over time before you get to the point where you would be ready to do a written agreement. But for sustainability of efforts over time and really being committed to working together, it can be a positive thing for growing that relationship and also spanning maybe different different leaders who are involved. An agreement can help sort of ensure the sustainability of the partnership over time.
We have several really great questions here that we're not going to be able to get to today, but just want to let those of you who have asked the questions know that we will be responding to you via email in the next week or so. So look for that coming your way.
Great. Well, thank you again so much. We're going to move now to the Roadmaps to Health Action Center, which if you click on it, it will look like this on our homepage, and you can find guidance and tools for each step of the Take Action cycle. And you can either click on the step of the action cycle or click on the Action Center to get to the guidance. And you'll find it, the guidance for assessing needs, for focusing and prioritizing, for choosing effective policies and programs, and that's where the What Works for Health database is as well. For acting on what's important, which actually many of the tools and processes Jerry and Christina mentioned, you can find and act on what's important. For example, the action plans and vision and so forth. And also you'll find guidance for evaluating, which some of your questions are around how to pick some measures. And the Communicate Guide has specific guidance on how to talk to media as well as engaging the grassroots and decision makers. And you can go to the Work Together Guide and find guidance on collective agreements and working together in vision and strategic prioritization and that sort of thing. And I'll just show you very quickly, if you went to the Work Together Guide, that this is what it would look like. And you'll see all the blue on the left are live links into each of those key activities. And then we always try to highlight sort of our top 5 to 10 kind of best practice tools, if you will, tools that we've seen out and about that really have made a difference in community work. And I'm just going to highlight one very, very quickly here called the historygram process. If you clicked on the historygram process, what you'd find is a tool, and you'll have a facilitation guide for it as well, that helps groups build on past change efforts and develop the values they want to take into the future. It's a great way to start with a values-driven vision that brings everybody together on one page. The benefits are that people feel really appreciated for their experience and their wisdom and their perspectives. Everybody's been part of the community for some time, and what they're being honored for is this isn't just a brand new coalition, it's, hey, we're going to continue that good work. And then also it's a benefit that there's strategies that you can look at that haven't worked in the past, so you don't just keep doing it in the future, and it helps you sort of look at what will work here in our community. The first step is you form a visual human timeline of when each person arrived in the community. Then from there you break into era groups where people are grouped together according to the years they joined the community. So for example, the people who have been in the community longest will work together. The people who have been in the community next longest, they work together. In these small groups, they create storyboards, which are visual representations of that era, describing the major health initiatives at that time, what was going on in the community and the world, and if there were any specific events or turning points that shaped that part of the community's story. They are also asked to identify values and behaviors they want to keep from the past, and new values and behaviors they want to start doing, and values and behaviors they want to stop doing and leave behind. So for example, a community might say they want to keep focused on children. They want to start bringing in more faith-based organizations. They want to start engaging youth more in health improvement discussions. And they want to stop working in silos, talking only, quote, to our own people and the people we feel most comfortable with. From working in those small era groups, everybody comes back, shares their storyboard. You start with the oldest era, and then the whole group steps back and identifies themes, patterns, and cycles that have made up the community's history. And what patterns do they want to continue or stop? Then this becomes a springboard for developing that values-driven vision statement that can guide the work of the entire partnership and the community. So if you want to build shared commitment for moving forward, especially when you need to bridge across multiple organizational and neighborhood boundaries, you might want to consider using the historygram process. It's adaptable for groups from size 8 to 80, and with multiple generations. I'm going to just move into our summary and wrap-up. We're at the top of the hour, and just come back to the essential question. We hope that we are able to answer this question for you today, and you're walking away with some ideas for taking the next step. Again, thanks to the support of the Robert Wood Johnson Foundation, we do have 3 community coaches in our program, and our assistance comes at no cost to you. So please don't hesitate to contact us if you need assistance with a tool, a question, or a next step in your process, and we will get back to you on your questions. There are some new partnership webinars coming up on May 21st. We have the Greater Flint Health Coalition and the Neighborhood Policing will be presenting their partnership. And on June 11th, we'll be hearing from Carol Morley, who's the former president of NACCHO, and she will talk about public health partnerships. As always, we invite you to stay connected with us, and Karen is chatting some of those connections there.